Hey everybody, just decided to stop, just try to hop on here tonight and just discuss more stuff about knee pain. Tends to be something that people deal with a lot. And well, here we go again, back of the knee though. Um, and you know, it's it's difficult. It's not easy sometimes when you have pain in the back of the knee. Sometimes it's hard to trace. A lot of times, we all think that it's hamstring. Hey, Gene. Sometimes we think it's knee pain, hamstring stuff back there. That's the only thing we know about, right? Tends to be hamstring. Think about back of the knee, think about the hamstrings. Hamstrings are in the back of the knee. Most of the time, it's not a meniscus. Most of the time, it's not a ligament injury back there. Those two things tend to be kind of traumatic. Either a fall on your knee, a pretty bad fall on your knee, or dashboard injury, or a pivot and a compression on your knee. So the meniscus and ligament stuff tends to be generally traumatic if you feel on the back of your knee. Will you maybe have a cyst back there? Yeah, it can happen. But most of the times, it's either thought of as a hamstring strain, which, kind of makes sense just because they're back there. But not a whole lot else is thought about as far as what could be generating pain. And really, just get a picture up here to show you guys. If I could turn this thing around here. How am I doing this? There we go. Anyway, so let's see here. So as you can see, I don't know if you can see, I'm hoping you can see. Let's see if we can get maybe a little bit closer without hitting the keys here. Anyways, it's not an iPad. So there you got it, right? You have not a whole lot there. You got arteries, you got veins, and you got nerves. And that big one right down the middle where the arrow is your tibial nerve right there. And you'd be surprised how often that thing ends up being considered a hamstring when it's not. Obviously, it's a nerve. Your hammies tend to be slightly more on the outside or on the inside. Down the middle here, there's just not a whole lot there. And like I said, you have meniscus and you have, maybe your ligaments, but those tend to be generally they tend to be traumatic kind of injuries. They tend not to be something that you get something that slowly creeps up on you. A lot of times people think of the hamstrings, and I got to tell you, in the clinic, more than half the time, it's not the hamstring. A lot of times when we stretch this thing out, this area out, it ends up maybe feeling better for a little bit, but it gets worse. But it'll act like a hamstring though. When it's a tibial nerve pain, it'll act just like it. When you stride out, it'll bother you. When you stand up, it'll bother you. When you, get out of your car, it'll bother you. Now I've had this. I kind of know what this feels like, and I know how to find it, clinically, because I know exactly how it feels. And sometimes some of that pain might kind of bleed down into the outside of your leg, as you can, there's branch. Well, let me just go around. Yeah. So anyway, there's branches that go down around the outside of your knee, right here. It's your common perineal, and it splits off into your deep and superficial perineal nerve, and they end up getting in the mix sometimes as well with knee pain all the way down your leg. So is it, I don't know, is it calf pain? You know, tibial nerve, maybe. Yeah, sometimes that is the case. Sorry, I keep on looking at the picture back there. But anyways, a lot of times when we stretch this area out, it feels right. It feels like we're stretching the area, and it does feel like a stretch. But sometimes it's not the hamstring. And I would venture to say that more than half the time, from what I've seen, when the pain is in the back of the knee, it tends not to be the hamstring, what I see. I'm just going off of my, just what I see clinically. It tends to be the tibial nerve. But it does act like a hamstring when it's irritated. And some people that have had maybe some pain in the back of their knee, maybe they've also had pain in the back of their leg, their lower leg, their calf. Maybe they've also felt like they've had hamstring kind of pain in the past, which is your sciatic nerve. A lot of times your hammy doesn't get hurt too badly. It might get hurt initially, but if it keeps on getting hurt over and over and over again, generally that's, in my clinical experience, the sciatic nerve. It's sometimes, or more often than not, the muscle or the tendon. Normally, the hamstring, if it's going to be a tendon irritation, it's going to be where it attaches up top at your ischial tuberosity, way up by your butt. That's where most of the pain will be. If it's a tendon associated with your hamstring, mid-substance of your hamstring, yep, that'll be a tear. It'll be black and blue. It'll be pretty obvious. And those are the things that tend to have a hard time healing. Because once it gets black and blue, it might heal. You might have some flexibility in the muscle, but the nerve just doesn't quite get relaxed forever. Sciatic nerve tends to get gunked up in there, and every time you take a stride, it'll tend to kind of stretch itself out because it won't slide and glide like it wants to after a lot of bleeding, after a pretty bad hamstring strain. So anyway, I just wanted to hop on and just give you guys some advice about what might be going on in the back of your knee. If you've been dealing with pain in the back of your knee and you've been stretching it like it's a hamstring, and it's not getting better, it still shows up and it hurts whenever you get out of a chair or while you're sitting even sometimes, driving a long distance, particularly your right leg. Or if you prop your foot up on the ottoman or recliner and you start to get some pain in the back of your knee, or you don't feel it then, but you feel it when you pop up and get up, sometimes, or more often than not, it tends to be the tibial nerve, particularly if these people have had maybe some pain in the back of their leg, thinking that it's calf, pain in the back of their hamstring, thinking that it's the hamstring, and it might actually be the sciatic nerve. And I know how this stuff behaves because right out of PT school, I got back to running again, and I loved it, but I started stretching my hamstrings after my run. And I felt it in my calf when I would stretch my hamstrings. And I thought, well, you know what? I'm not stretching my hamstring. I'm not stretching my calf. I'm stretching my hamstrings. Why do I feel in my calf? It must be nerve. So I started flossing my nerves a little bit, just a technique that you learn in PT school. And what I didn't know is that it was super aggressive. I didn't know that until 3 days later when I couldn't get out of the car when I tried to get to work. And that lasted for 6 months. And my per mile time went from 7.5 minute mile pace to almost 20. Why? Because I couldn't stride anymore. And I knew that I irritated my sciatic nerve stuff. I was pretty confident because I felt it all the way from the back of my hamstring past my knee into my calf, nearly every stride, unless I really super slowed up. So, and then the next 3 to 5 years, it was probably closer to 5, depending on if I was riding my bike or running. If I was riding my bike or if I sat down long for work, it hung around and let me know. I don't have it anymore, but it made me take a deep dive into nerve pain and why it tends to hang around, and why it just ends up being something that just won't go away unless you treat it right, particularly stretching. But anyways, hope this helps. If you guys want to know anything about anything else, let me know. Let me know what your pain points are, and we'll talk about it. Let's see, I just want to thank some people real quick for coming on here. Gene again, thank you. Robin, Samuel or Sam, Herb, hey man, how you doing, bro? Good to see you on here. Bert, Jennifer, Stephanie, hey Stephanie, hope you're doing well. Juliana, Shannon, and Michael, thanks for hopping on, guys. I hope I helped you out a little bit. At least try to figure out, maybe I shouldn't be. And most of the time, if it's not going away and you're thinking it's hamstring and you're stretching it out and it's not going away, particularly, and you can, let me just turn it around here. A good kind of telltale sign for you guys, if that's easier. So just kind of, if you're trying to figure out if it's maybe possibly nerve or not, just sit down, kind of straighten your leg just a little bit and put your thumb or your finger right in the middle of your knee and put some pressure on the back of your knee. Leave it there maybe 5, 10, 15, 20 seconds. And over time, if it starts to kind of get achy and irritable in the back of your knee, or maybe even fade up your leg a little bit or fade down into your calf a little bit. And if you saw in the picture, the tibial nerve is right in the back of the knee. There are no tendons there. They go towards the outside. You saw that kind of a square where your hamstrings come out and your to the tendons, and then your calf kind of comes up and passes your knee actually and connects on the bottom part of the back of your femur. So you have this kind of a weird kind of a shape. I think it's called a rhombus. I can't remember. Anyway, so there's nothing there. So if you put pressure right in the back of the knee, straighten out your leg a little bit. If you think you're dealing with this, put your thumb right in the back of the knee in the center of it. And that's where your tibial nerve is. It might be just slightly out towards the outside, but right there. And after 15, 20 seconds, if that reproduces your pain, it's probably your tibial nerve and not your hamstring. So stop stretching, okay? In my group, I put a video up saying stop stretching your hamstrings, because most of the time, some of the pains that we have in the back of the thigh, back of the knee, and the calf, often enough, it's not a muscle, it's the nerve, and they don't like to get stretched like that. They like to be mobilized and moved, but they kind of don't like to be stretched out. That's not kind of their thing. But anyway, hope this helps. And and Charlene, thanks for hopping on. Appreciate your time. And Shauna, appreciate you guys' time. Really, you guys probably have better things to do. I'm just hoping to give you guys some good content. And coming up this coming Wednesday, I have a gal that really knows her stuff. She's a registered dietitian and she's a runner. She enjoys working with the running community a lot. So we both have the same audience that we're trying to target, but she does it from a direction that I have very little knowledge of, and I try to just get by. But she'll be here to answer all your guys' questions. We'll go for about maybe half hour, 45 minutes. We got some preset kind of questions. If you guys want to ask her anything, hop on. It'll be 8 o'clock this coming Wednesday night, and looking forward to it, and just giving you guys some great content. She's going to probably, whatever you guys' questions are, but we'll start with a couple. But she's going to help dispel some of the myths and some other stuff that, you know, a lot of stuff out there that people are wondering about. Yeah, so it'll be good. I'm excited about it. And just hop on Wednesday night, 8 o'clock. Danielle Strabel. She's awesome. And thanks again. And hope you guys have a great night. Enjoy it. And just hang out with family, reconnect, do some great stuff, and good vibes. And we'll see you guys. Take care.